The Center for Sustainment of Trauma and Readiness Skills, also known as CSTARS, is an Air Force medical training program embedded in civilian academic trauma centers to provide hands-on, real-world medical trauma training for airmen. As part of the U.S. Air Force School of Aerospace Medicine, within the 711th Human Performance Wing at the Air Force Research Laboratory, CSTARS sites are total force platforms led by physicians, physician assistants, nurses, and medical technicians. Airmen scheduled to deploy are identified for 2-week training rotations at CSTARS sites. The program pairs Air Force medical rotators with CSTARS cadre, embedded Air Force physicians, nurses, and technicians working with their civilian counterparts to care for critically injured and ill patients in regional trauma centers. There are multiple CSTARS sites across the country: Baltimore, Maryland, Dayton, Ohio, Cincinnati, Ohio, St. Louis, Missouri, Las Vegas, Nevada, and Omaha, Nebraska. The University of Cincinnati Medical Center in Cincinnati, Ohio, serves as the validation platform for Air Force Critical Care Air Transport Teams, known as CCAT. Physicians, critical care nurses, and respiratory therapists are trained and evaluated on their performance in high-fidelity simulation mission scenarios. Knowledge of airworthy medical equipment, table of allowances and supplies, and the implementation of the Joint Trauma System and clinical practice guidelines. The Soin Medical Center in Dayton, Ohio, hosts the Enlisted Critical Care Course, a specialty experience identifier awarding course for Air Force medical technicians to gain experience in the inpatient critical care setting. The course includes didactic and hands-on critical care training in a critical care unit setting. With successful completion of this course, students have the knowledge and skills necessary to meet the wartime mission of caring for critically ill patients in high-acuity critical care environments. The University Medical Center R. Adams Cowley Shock Trauma Center in Baltimore, Maryland, the St. Louis University Medical Center in St. Louis, Missouri, and the University Medical Center in Las Vegas, Nevada all support CSTARS sites offering comprehensive medical readiness program training, providing Air Force medical personnel the opportunity to participate in the care of critically injured patients, to keep them ready for the downrange expeditionary missions associated with their medical specialties. This multidisciplinary course provides education and hands-on training on ground-based expeditionary medical capabilities with a focus on resuscitation, damage control surgery, and intensive care. The CSTARS site at the University of Nebraska Medical Center in Omaha, Nebraska conducts the Principles of Biocontainment Care, which focuses on ground support and clinical concepts associated with the care of patients with high-consequence infectious disease in a biocontainment or high-level isolation environments. CSTARS Omaha is also developing a new course, the Infectious Disease Air Transport course, which focuses on the transportation of highly infectious disease patients. These courses cover recognition, diagnosis, and management of hazardous communicable diseases, infection prevention and control principles, communication, skills training, and simulation scenarios. The CSTARS program has transformed Air Force trauma care, contributing to the lowest case fatality rate for U.S. personnel in the history of war. The advancements have also translated into the civilian sector, saving even more lives. Ultimately, the CSTARS program equips our medics with state-of-the-art skills and confidence, provides reassurance to our warfighters and their families, and acts as a deterrent for our adversaries. Just one more unique and remarkable way that the 711th Human Performance Wing mission helps the Air Force Research Laboratory deliver advanced capability to the field every day.